Stop everything right now and pay close attention, because what I'm about to reveal could completely change your decision about whether or not to have hip surgery. If a doctor has already told you that you'll need surgery someday, or if you know someone who had hip surgery and ended up worse than before, there's a side of this story that almost no one tells you. I'm going to show you the full truth about hip replacement surgery, what works, what doesn't, and most importantly, when it's truly necessary and when it can be avoided. Because ignoring this means making a decision based on incomplete information. And when you understand the whole picture, you may realize there's still a path you didn't know existed. Let's begin. If you've already heard a doctor say, sooner or later you'll need surgery. If you're afraid of ending up on an operating table. If you know someone who had surgery and went through months of painful recovery, you know exactly what I'm talking about. And it's not just fear of the surgery itself, it's everything that comes with it. The long recovery, the uncertainty about whether it will work, the fear of getting worse, the dependence on other people, the feeling that your body is betraying you. Many people postpone the decision for years. Others rush into surgery believing it's the only solution. And both extremes can be dangerous. Now let's talk about the truth that few people mention. Hip replacement surgery can save lives. It exists for a good reason. When the joint is completely destroyed, when the pain is unbearable and nothing else works, it can restore quality of life. But here's the problem. Not every painful hip needs to be replaced, and not every successful surgery delivers the outcome you imagine. Let me explain. Hip surgery involves cutting bone, removing the natural joint, and placing a metal and plastic prosthesis in its place. Full recovery can take 6 months to a year. And during that time, you'll need help with basic daily activities. In the first few months, you can't drive, you can't climb stairs normally. You need crutches or a walker. You need intensive physical therapy. And you feel pain, often a lot of pain. Even after recovery, there are limitations. You can't squat fully. You can't cross your legs. You can't make sudden movements. And depending on the type of prosthesis, it may last 15 to 20 years. After that, another surgery may be needed. This isn't meant to scare you. It's meant to help you make an informed decision. Now comes the part that changes everything. Studies show that a significant percentage of hip surgeries could have been avoided if action had been taken earlier, much earlier. Because there's a stage in joint degeneration where the process can still be reversed. But most people only learn this when it's already too late. The problem is that pain doesn't reflect the real condition of the joint. You can have severe pain and still have a recoverable joint. Or you can have little pain while destruction is already advanced. And here's something almost no one explains. Surgery treats the final outcome, not the cause. It removes the damaged joint and replaces it with an artificial one. But whatever destroyed the joint in the first place is still there. And do you know the root cause that surgery doesn't fix? Let me ask you a question. If the problem were only age-related wear and tear, why are there people in their 70s with perfect hips? And why are there people in their 50s with joints so damaged that surgery is required? Science has discovered something surprising. Harvard researchers analyzed thousands of ancient skeletons, people who lived centuries ago. They walked long distances every day. They squatted, carried heavy loads, and worked hard their entire lives. Scientists expected to find ruined hips, but they found the opposite. Most had healthy, well-preserved joints. If it were simply a matter of use, they should have been destroyed. But they weren't. The conclusion changed everything. Natural wear and tear is not the main cause. There's another factor at play. And that factor is the loss of an internal protection most people have never heard of. Inside the hip, there's a space filled with a protective gel. Scientists call it joint gel. This gel has 3 vital functions. It lubricates the cartilage so the bones glide without friction. It acts as a shock absorber, absorbing impact, and it nourishes the cartilage, delivering oxygen and nutrients to the cells. When you're young, this gel is thick, dense, and functional. But after the age of 30, you begin to lose a substance called hyaluronan. Scientists call it the guardian of the joints. Each molecule can absorb up to 1,000 times its weight in water. That's what keeps the joint gel thick. Lose hyaluronan, and the gel dries out. It becomes thin, weak. And without this protection, three things happen. The bones move closer together and begin to rub. The cartilage stops receiving nutrition and starts to die. And inflammation invades with no barrier at all. That's where the destruction leading to surgery begins. Now you understand why anti-inflammatory drugs don't solve the problem. Why physical therapy alone isn't enough. Why glucosamine and chondroitin may have failed you. Because none of these restore the joint gel. None of them replace the lost hyaluronan. They treat symptoms, not the root cause. It's like trying to put out a fire without shutting off the gas leak. And here comes the story that changes everything. In a remote mountain village in Japan called Yuzurihara, people in their 70s, 80s, and 90s work all day squatting in the fields. They move their hips constantly. They carry heavy loads. And do you know how many of them need hip surgery? None. Scientists investigated and discovered something in their daily diet that keeps the joint gel dense and functional. Something that protects the joint even after decades of intense use. But what is it? And how could someone access it? Today, there's a natural approach based on this discovery. It works on 3 levels. First, it helps restore lost hyaluronan, thickening the joint gel again. Second, it fights the inflammation that's destroying the joint. Third, it helps the body continue producing this protection over time. Studies show that when you act at this level, many cases once considered destined for surgery can reverse course. But don't be fooled. This isn't magic. If the joint is already completely destroyed, surgery may be unavoidable. But if there's still cartilage, if there's still movement, if the pain is manageable, there may be another path. The key is acting before it's too late. The longer you wait, the lower your chances of avoiding surgery. Many people delay because they're afraid. Others rush into surgery because they think they have no choice. But between these two extremes, there's a third option that almost no one knows about. What can truly help avoid surgery is rarely talked about openly. Below this video, I've left a link that takes you to the next step. There you'll discover the secret of populations who live for decades without needing hip surgery, even while doing heavy physical work. How to naturally thicken the joint gel and give your hip a chance to recover before resorting to the scalpel. Click the link I left below this video and see how you can start today.